Agreed to, and I give the call to the member for Holt.
Yep, thank you, Deputy Speaker. And I rise to support the member for Macquarie's private member's motion on mental health, which notes that, that suicide is the leading cause of death amongst Australians aged 15 to 24 years. And you read the statistics, and in 2019, and this is from the Australian Institute of Health and Welfare, 384 young people took their own lives. And then you talk about suicide, 96 by suicide. Deaths by suicide represent 40% of all deaths in young people aged 15 to 17, 36 of all deaths in those aged 18 to 24, up from approximately 25% of all deaths in these age groups in 2010. And you read those statistics, that data, and you're horrified. I had the lived experience of this when we had a suicide cluster in the southeastern region in 2011 and 2012. And during that time, seeing, as you would drive to work on occasion, the names of a name of a young person on a bridge, or you see on Facebook the loss of a young person, and then another young person, and then another young person, and the sense of community helplessness as to what to do. And I think the member for Indi was talking about Albury and the work that Professor Pat McGorry had done there. He also did incredible work down in the southeastern region of Melbourne during that time, which I think has literally saved lives, because what actually had happened prior to that and prior to Professor McGorry coming in, we actually called Pat in. He had been dealing with the issue of appropriate mental health facilities in Albury in dealing with this this suicide cluster. And we asked him to do the same thing, which he did come down, and in 2012 we conducted a forum that was covered by Four Corners, and they produced a program on it called There's No 3G in Heaven, and it featured some of the people that we'd actually lost. And Deputy Speaker, it's impossible to describe, and we conducted that forum with Patrick there, Pat McGorry, facilitating it. It's impossible to be there watching the parents of young people that get up and describe the impact of the loss of their child to anybody, to this chamber, to anybody. And the fact that we had 8 or 9 parents get up there and describe it, and describe how. I think it's one of the things that we don't discuss method. We don't want to discuss method, but there was a particularly brutal method that was being used by very desperate young people in that 2011 tour, which traumatised an entire community. And the fact that Professor McGorry came down, we lobbied, they put that program, it's No 3G in Heaven. It's a very confronting program, Deputy Speaker, but the result of that, and great tribute to then Mental Health Minister Mark Butler, 2 headspaces were funded by the then Gillard government, and an early youth psychosis centre was the overlay with that as well. That was the headspace, I think it's now in the Dandenong, which I think is in the member for Bruce's electorate now, and headspace Narre Warren, which is in the electorate of La Trobe now. Could be Bruce again, who knows, with the redistribute. He might have 2 in his electorate, Deputy Speaker, and that's a good thing. My electorate extends out to Cranbourne. It would be great to have a headspace in Cranbourne. I think also what I wanted to say, one thing that concerns me, I welcome the investment from the federal government and also the state government. The Victorian state government's invested over $3 billion in mental health. I think the issue, though, I worked in the mental health space between 1994 and 1996 as Chief Executive Officer of a mental health organisation. And I remember participating in what they called the first National Mental Health Strategy. And I remember the discussion was about young people and people not accessing mental health services because of the stigma. And I would still say, Deputy Speaker, that we still confront that as a barrier to people, particularly from non-English speaking backgrounds, accessing the services that they know and care. There are so many young people that I speak to that are struggling with issues that still will not go to a health service provider, a doctor even, or even a clinic or a headspace because of the perceived stigma of mental health issues in their community. So whilst I welcome this investment, it is quite worrisome when you talk to a young woman who's got a tertiary degree that wouldn't for the life of her go and access a service because of the stigma. So whilst I certainly welcome the member for Macquarie's motion, there is much, much more that needs to be done to confront the stigma so that we can encourage people to access these services.